should we start with the live now?
Yeah,
Okay.
Ve- Very good afternoon, everyone. Today's topic is let's continue with our second lecture on POCUS series and knows your machine well. So I would like to invite Dr. Yogesh Parikh sir to give your speech regarding this. Welcome, sir.
yeah. Thank you, Praful. Respected Chief Guest, our own Dr. Nirmal Choraria sir, Guest of Honor, Dr. Pradeep Suryavanshi sir, our today's distinguished faculty, Dr. Avneet Kaur, our all esteemed colleagues and the dear friends. It is immense privilege and pride to welcome all of you on this second session of our flagship academic initiative of the neonatal Pathshala, the POCUS series, the second session organized by our NNF Gujarat banner. So we know all this series is not just a program or CME, but it is a structured learning journey. So it is designed to empower every neonatologist and pediatrician with the practical skills that directly enhance bedside decision making and then neonatal safety. So today's topic is know your machine well, Knobology Matters. May sound simple, but it is a profoundly important masterly and of this ultrasound begins with understanding the very knobs and the control that guide us. So precision at this level translates into the clarity in the diagnosis and the confidence in care. And we have our own means very expert faculty for this session, Dr. Avneet Kaur. So I extend my heartfelt gratitude to Dr. Avneet Kaur for bringing her experience and wisdom to this platform. We are deeply honored by the gracious presence of our chief guest, Dr. Nirmal sir, guest of honor, Dr. Pradeep, and today's program coordinator, Dr. Biraj and Dr. Praful. So let me congratulate Dr. Mohit Saini also for this project in charge. He's not here because of his commitment and his flying in the sky. So as a president of Gujarat, I assure you that we will continue to bring high quality, practical and visionary program on this platform. So thank you for joining us today. Let us learn, share and grow for the future of neonatology. Jai Hind, Jai IP, Jai Gujarat. Jai NNF.
Okay.
So over to you, Praful.
Okay, thank you, sir. And now I would like to invite Dr. Nirmal Choraria, sir. He is a chief guest for today's event, and he is a director and CEO of Nirmal Children Hospital and Nirmal Multi-Speciality Hospital at Surat. And he is a very good, excellent, this pediatrician and intensivist, as well as a good academician also. He ran he ran the DNB and fellowship seats in the Surat also since a long. And sir, please say a few words regarding this lectures and POCUS series. Sir, Nirmal sir.
So I welcome everyone here. Our Gujarat NNF President, Dr. Yogesh Bhai, other office bearers, Dr. Praful, and guest of honor, Dr. Pradeep Suryavanshi, and of today's expert speaker, Avneet Kaur, on this Pathshala, Yantrik Pathshala for POCUS. It is the second lecture on Know Your Machine and Knobology. And the best part is today the guest of honor is Dr. Pradeep Suryavanshi, who himself have trained thousands of neonatologists and the pediatrician for the POCUS ultrasound in neonatology. I myself got trained under him for 6 months training of POCUS. So it's nowadays everyone say that ultrasound echo machines are like the stethoscope for a clinician. And after practicing for more than 40 years, and what I've seen has changed from beginning to today. But nowadays it is just impossible to practice without having a bedside echo. So you have to have a machine bedside to know each and every aspect of the baby, and then we can do the best results. Maybe it's a morbidity or mortality. So I welcome everyone and I express my heartfelt gratitude for everyone. Thank you very much. Thanks for inviting me for this program. Thank you.
Thank you, Nirmal sir. So we are selecting the our chief guest and the guest of honor on that particularly expertise of the session. So Dr. Pradeep is the only pioneer of this uh, focus series, and Dr. Mohit also joined, and Biraj also joins. Welcome, Biraj and Dr. Mohit and Dr. Snehal.
Good evening,
Dr.
sir.
Vishal also
Good
joined.
evening,
Yeah,
everyone.
yeah. Praful, over to you.
Okay. Now, Dr. Biraj will continue with, and please welcome Dr. Pradeep Suryavanshi, sir. Ma'am, for continuing.
Yeah, sorry to join a little late, and thanks, Rahul, for handling that portion. So, it is my privilege to welcome Dr. Suryavanshi, sir, who is a pioneer in focus and functional echocardiography in India. Sir is from the Pune, and sir is a professor and head in neonatology at PVU Hospital Medical College at Pune. And sir has multiple publications, and he had been an author at various books. And his special interest is functional echocardiography and focus. So welcome you, sir. And here I would like to request to address the audience and kindly gives blessings to for Bashala. Pradeep.
Yeah, thank you. Thank you, Dr. Yogesh, Dr. Biraj, Dr. Nirmal, my own crime partner Mohit, and Kunal, Satish, Ronak, Snail. It's a wonderful concept of starting this Pathshala. We as Indians are wonderful team members and teachers. So this concept of Pathshala is a wonderful for taking academics forward. And I could see last 6 years you guys have done wonderful work, and you have taken the POCUS with the leadership of Mohit in the form of POCUS series. It's a wonderful. I think the POCUS is the future. We all know we have been dealing this POCUS since 2009-10, and India is actually doing good in the world. Believe me, Indian system is working very well, and a lot of people are enjoying this POCUS all over the world. Only my request to all my young friends, please, along with this learning, put more efforts for research. If in the next 5 years, if we have 100 to 500 publication from India in the field of focus or hemodynamics, we will be respected very well. If you all require any help, recently I have taken editor post of Frontiers in Pediatrics, mainly the neonatology section. If you need any help in focus and hemodynamics research or articles or publication, I'm always there to help you out. But those members who have recently done DM, DRNB or fellowship, along with clinical practice, please think about research. Clinical practice we all have to do, no choice on that. But once we do the research, we are already ahead in the world from others. So my suggestion to the NNF Gujarat, please put one more aspect in this series as the research component. That will be good for India or taking forward our focus series to the world level. Thank you for inviting me. And I don't want to spend too much time because one of the wonderful speaker is in pipeline. So Avneet is there. So I think Biraj, I hand over to you. Thanks for inviting.
Thank you, Suryavanshi sir. And as you suggested, as just to take a first step, our next session is about journal club, and every third Wednesday is the journal club. So thanks for immunizing us, and definitely we'll take care about the same, and we'll just try our best to take this at the further and a further height. Thank you, sir. And now I request Dr. Praful, who is the backbone for coordination and conduction of this program. As a scientific coordinator, he's a consultant from Surat and one of the EB member. So, Praful, please hand over to you and take this program further.
Thank you, ma'am. And Today's topic, as already Sir said, on this POCUS, our second lecture, and moving forward with our eminent faculty, Dr. Ramneet Kaur. She is a senior consultant and head of the Department of Neonatology, Apollo Cardinal Motinagar, New Delhi. She was awarded with many awards. One of that is awarded with Best Neonatologist North Zone by Times Network Group. She also awarded with Indian Guiana Award of Neonatology 2015 by AAP also. She also had a post of Joint Secretary of NNF Delhi 2021-23, and she had multiple more than 50 publications in various journals. So without wasting so much time, all of us are ma'am waiting for your precious knowledge, and please share your knowledge with us. Thank you, ma'am.
Thank you. Thank you, Dr. Praful. First of all, I'll convey my regards to NNF Gujarat for inviting me. And it's a privilege to be in front of my seniors, Dr. Pradeep, Dr. Mohit, who are like the masters of POCUS. So I think it's indeed a big privilege to be around at this network, at this forum to present this thing. So without wasting much of time, I'll share my presentation. So the topic, I hope my slides are visible.
Yes, ma'am.
Dr.
Yes, ma'am. Yes, ma'am.
It is.
Yeah. So the topic which has been allotted to me is not something fancy. It will not give us a lot of like fancy or difficult diagnostic images. But the most important topic which will help us to learn ultrasound and optimize image is very, very important, because to come to fancy diagnosis, we first need to learn our basics well. So the topic which is there today is to learn our machine well, which is the knobs and the bonnets of our machine, and how to improve our image quality. So, as we all know, I'll be covering this presentation in the format that I want to show a few clippings which I've tried to record from my unit. It was actually, I want to do a live demo of all the machine, but in view of the issue related to the network, so that's why I've made some clippings, and I'll be like dividing my presentation accordingly. So in this presentation, I want everybody not only to learn about the image optimization, but also to learn how to make patient data entry and image acquisition, about the types of probes and different modes, how to select, and then eventually to optimize the image. And the most important 6 players which helps in image optimization, which is the depth, focus, gain, time gain compensation, zoom, and the sector or the color box width, which I'll be discussing in detail in my slides. So, so the first and foremost thing which we want to do while doing our echocardiography is to select the preset and the area which we want to do, because once we select that, then only our machine is able to select the right preset and give us the right baseline settings for the machine to choose that what frequency or what baseline characteristics the machine needs. So first we choose that which area we want to do the scanning, whether it is an echo, whether it is lung ultrasound, brain ultrasound, abdomen, or we want to go for the vascular ultrasound. So when we choose, then the machine has various presets, and then it chooses the frequency and depth accordingly. Based on that, we can choose our transducer, the type of image we want to acquire. So we have like 3 different types of probes which are available. We have linear probes, we have curvilinear probes, and we have the phase array probes. And we know that they all are different and they can be used for different systems. So first we talk about the linear probe. The linear probes are the one which has a higher frequency, and they are rectangular in shape, and it is mainly used for superficial structure, and the frequency it uses is typically more than 7.5 hertz. Now, the linear probes are typically used for lung ultrasounds or the vascular ultrasounds or the musculoskeletal ultrasounds, because they acquire images which are superficial structures, because higher the frequency, better is the resolution, and lesser is the depth what we're looking at, and superficial is a structure which acquires. Curvilinear probes are ones again which have a lower frequency. They are convex, they acquire a convex image, and they have a larger footprint. They are routinely used for our ultrasound abdomen, and they use the frequency of approximately 3.5 to 8 hertz. Phase array probes again has a smaller footprint. It gives a sectoral view and it is like typically of lower frequency. It helps to detect for the deeper structure, and it has a lesser contact, like smaller footprint. So it is good for the deeper structure and smaller babies where we need lesser area to make our image acquisition. And it uses an like frequency anywhere from 3.5, we can go up to 10 to 12 hertz as well. Now, once we have picked up like the probe, we should understand this concept that superficial structures are better seen with high frequency, as I told you about the linear probes. Deeper structure are better seen with the lesser frequency probes, as we do for the cardiac ultrasounds. So superficial structures, we only mainly use the frequencies here, which are like ranging from anything from 8 to 15, 16 hertz. And for the deeper structures, we can use anything from 4 hertz to 12 hertz. So higher the frequency, better is the resolution, but lower is the penetration. Lower the frequency, higher the penetration, but lower is the resolution. Okay. So linear probes, which are high frequency probes, higher resolution, but lower penetration. Whereas when we use the cardiac probe or the phase array probes, where we are using lower frequency, higher penetration, and lower the resolution. So multi-frequency probes nowadays are available, which can range anything from 4 to 12 hertz. Now, once we have chosen our organ, we have chosen our preset, we have chosen which organs we want to evaluate, and in the preset we can also choose that we want to go for a term or a preterm neonate. So automatically you can talk to your engineer and the engineer can easily create these presets in your machine, and based on that the machine can pick up, like suppose for a preterm baby, if I have a multi frequency probe, then the echo it can pick up 6 to 8 hertz, whereas for head ultrasound we can go 8 to 10 hertz for a term baby, and for a preterm baby the machine will pick up like 8 between like 10 to 12 hertz for an extreme preterm baby, and the little bigger ones it can pick up to 8 to 10 hertz. So all these presets can be discussed with the engineer and created in our machine per se. Now, once we have selected our organ, we have chosen our preset, we have chosen our probe. Now it is a time that we go to we should understand that how our probe orientation marker works. So you all can see that we have a probe orientation marker here. So this is my probe orientation marker. And when I place my probe orientation marker towards the left side of the baby, like I have placed this probe and the orientation marker is towards the left. So what I can see in the image is the marker showing is the left side of the image. So left side of the baby. So this tells me that which side I am interrogating. So this orientation is very, very important to learn that how I am acquiring my image. Now, so if you can see in this, oops, 1 second, it's not playing. Okay, so I think I'll go directly to my videos. My videos. Just 1 second. I'll reshare it because video was not playing. So this is the ultrasound machine which we use in our unit, and this is. Can you all hear the audio? Dr. Prabhu?
Yes.
Yes.
So
But you can make the volume a little bit loud,
okay.
if possible, yes.
Yeah. Is it? I'll play the video. Okay. So my first video which I'm playing is basically how to acquire the image. Okay. So tell you about the machine and acquire the image. So I've tried to make some videos and divided into Philips Affinity 50G. So it's very important whenever we are using any machine to know about the knobs, because without knowing the gears, we cannot drive a car. Similarly, without knowing the knobs, we cannot run our machine. So first we'll let you know about all the knobs and how the screens and whatever is available, the transducers, what type of transducer, how to connect the transducers while using this machine. So first and foremost, we should know how to switch on this machine. So this is the button to switch on and switch off. And once, I've already switched on the machine. Once we have switched on the machine, first and foremost thing which we have to do is to do the entry for the patient details. Okay. So when I have pressed the patient, I can do the first and foremost about the entry for the name of the patient. So suppose I put like Avneet, and then I put some ID number for the patient, and I have the ID number ABC4, and I can select the gender like a female, and case performed by AVI, and I can select the study type here, and suppose I want to do a pediatric echo, and I kind of finish it off by doing that. I've entered most of the things and I'm done with this. Now once I have entered the patient details, now I have to select that what kind of ultrasound I want to do in this. So when I decide that I want to do ultrasound, I will be choosing again pediatric echo. And now I've chosen the pediatric echo, then I have to choose which type of ultrasound and then the type of probe I need to do for that echo which I do want to do, or ultrasound abdomen I want to do, or lung ultrasound or brain ultrasound, whatever. So based on the frequency and the footprint, as we have learned from Dr. Kamal's talk, that we have majorly 4 types of ultrasound probes which are available. And so commonly what we use is the phase array probe. Phase array probe that we have available is from frequency of 4 to 12, and you can see it is a smaller footprint and it gives like a fan-like image. And then we have this S2 to S4, which is like commonly used for the pediatric echocardiography, which is like a frequency of 2 to 4. And then we also have the next probe, which is the linear probe. So linear probe, we have learned again that linear probe are usually of the frequency typically 10 to 14, and we usually use the higher frequency probes, which gives us the image which is superficial but a better resolution. Okay, so higher the frequency, better is the resolution, and less deeper or more superficial structures which is able to visualize. And similarly for the linear probes, we also have the hockey stick probes, which is further higher frequency 14 to 18 and a better footprint for assessing the lung ultrasound. So now how do I go about choosing the probe? So as you can see, we have a soft image like marker here where we can choose the probes, and in this I've chosen the S4 to 12 probe. And once I've chosen the probe, it then asks me that what kind of imaging process I want to do. So here I've chosen, suppose I've chosen the pediatric, and then in pediatric I want to go for the echo, which I had already chosen on the screen. In the same way, if I choose this, I can also do like this preset, which is the neonatal head preset. So based on that, it will automatically select the frequency it needs for the neonate. So in our machines, we can tell our company provider to create some presets. Like we can create preset for, in the linear probe, we can create a preset for vascular, we can create a preset for musculoskeleton, we can create a preset for lung ultrasound. Similarly for the phase array, which we are using for the echo as well as the ultrasound cranium, so those presets can be created. In those presets, we can also create presets for like we want to do for preterm or term. So you can talk to your company provider or the engineer who can come and create these presets that which kind of thing we want to do. Now, once I've chosen this, again, I'll go to this thing, and I've chosen the echocardiography. So when I have chosen this, but also we need to understand that how do we need to see that is this probe connected down or not. So as you can see in this, that this is how this lever, if I open this, I will be able to remove this transducer connector and lock it. So if suppose this S2 to S4 is not connected, so I can take off the linear one and I can put this and connect this probe. So that will be also available to see once other. So we need to also know how to change the probes when how to connect it to the machine. So now when I have chosen my transducer, next most important thing which I need to understand in my transducer is the probe orientation marker. So as you can see, this is my probe orientation marker. So the same probe orientation marker when I'm seeing on the screen is available in form of P. So this tells me that when I keep this probe on the baby, and suppose I'm keeping it on the left side of the baby, so this left corresponds to the left side which is seen on the screen. So if this probe is lying on the apex of the baby, so that tells me that I am seeing on the left side of the image, which is here, and if it is on the apex, that thing which is closer to the apex is the left ventricle. So that probe will be closer to my left ventricle. So probe orientation marker can be adjusted on the screen. If I want it top, it is like this. If I want to keep it down, it comes like this. If I want to change it to left, it will like right, it will be down like this. And if I want to take it up on the right side, it will be like this. So probe orientation marker needs to be like commonly for the echocardiography, we keep it on the left side, and like how I was trained that in four chamber view, we usually keep it like how the normal orientation of the heart is, we keep it down, and rest all the views we keep it on the upper side of the screen. But however, everybody is trained in a different way, they can adjust it as per how they want it. So next thing is that we have like saved some clippings and or some images. Now we want to export those images to our laptop, or we want to use it for some patient review purpose or presentation purpose. So how do we export those images? So what I'll do is, first I will go to my review images. Once I've gone to the review images, I will select those images, and like I have these two images which are saved here. So I press select all. Now I have selected these two images and I want to export them. So once I press this export button, so it will ask me option that you want all the selected images, yes. And then where do I test? So if I have to take it, like I can do it in a CD, or I can export it to a pen drive. So there are some options available on the machine. If you can see, there is an option for the pen drive, and there is another option which is for the CD. So we can select any of these, like suppose I selected this, and then I want this format in form of a DICOM, or I want it format, it will show JPEG also. And once I've selected, it will okay, and it will get to whatever thing which I have selected to. So that's how I can export my images. So this is the ultrasound machine which we use in. So we have made some patient data like entry about the details of the patient, but we need to know something more about how to use the central console. So the central console mainly consists of this trackball button, and this is like the click button. So normally we use this trackball, as you can see on the screen also, this trackball is rotating to mainly, select something. and if we want to use, like, suppose pointer. So this pointer button is pointer, you can see on the screen that this pointer is available, and I can, you know, change the pointer position using my trackball button. And we also have, like, for the image acquisition, like suppose I have done a video of like a baby, like this, suppose this is. So now if I have to select it as a video, or if I have to select it as a snapshot, so I can use it. If I done this and I use the freeze button, and I use this acquire button, it will save the thing as an image. And otherwise, if I unfreeze it and I'm just doing it and I acquire button, so then the same thing is selected as a video, as a clipping. Now how I can see these clippings? If I press my review button, I can see how you can see this, that this thing is selected as a video recording. And if in case I want to see this button, and if I see this is recording as a snapshot button. So I can use my review button to see all the images which I have stored, and I can use select them as a video clipping or as a snapshot button. The clipping size also can be adjusted. You can select it as as a time based clipping, or sometimes we use it as a cycle based clipping. So if you have ECG lead connected and you have, like, you know, what cycle is going on, so based on cycle or based on the time, we can adjust this, saving the thing. Now what else you can see on this area is, as I told you, this is pointer. Then you can also use label. Now if I have something which I have selected and I want to label it like as AVN, something like that, so I can save it as a that okay, I have recorded this area and this annotates for this thing. Now another button which you can see here is the measurement button. So this is like my caliper. If I have to make some measurement, I select this and then I make another get this number and I select it, and it automatically calculates that what amount of, like, you know, what is the size of this area. So you know, this is my central console. So mainly these two videos which I have tried to cover is only to how to enter, get the patient details, and how to acquire the image, and how to select the probe. So I've just basically covered the simplest most part of the machine, that is the center console, and to talk about the patient data acquisition and patient the kind of probe which we want to select and the kind of ultrasound which we want to do. So this was the very basic stuff of an ultrasound machine. And now comes the main core thing which we want to learn today is, like, how to acquire the image and how to improvise the acquisition of the image. So I think we learned from Dr. Kamal's talk that first we need to decide that how do we proceed with the images, that we want to first do the 2D mode, and 2D mode is your basic B mode. And once we have done that, and in some of the things we will need the color, which is the color Doppler, then we want to go for whether we want pulse wave Doppler. And we know that pulse wave Doppler is velocity dependent, and if we have higher velocity stuff, we need to go to the continuous wave Doppler. And if we have to measure, then we need the M mode Dopplers. So all these details have been already discussed in the previous speaker's talk, which I'll not be covering, but I just want to show you the same things on our ultrasound machine, that where are these things and how we kind of take these Dopplers and use these buttons. Understood about the image acquisition and the patient data entry, about the probes. Now we need to understand about the modes. So as Dr. Kamal has told us about few modes, like we have the 2D mode, we have the color mode, we have in Doppler, we have the pulse wave Doppler, then we have the continuous wave Doppler, and then we have the measurements mode or the M mode. Now, the first and foremost mode which we talk about is the 2D mode. 2D mode is what is? It's the brightness mode. Okay. So we pick up this B mode or the 2D mode, and when we put it on the baby, the 2D mode. So, and we adjust our image, as you can see here. Okay, now we are adjusting our image. We adjust the depth of our image. Okay, you can see here. We are trying to adjust the depth of image, and now once we have put this 2D mode, we have adjusted our image optimized. So I'll discuss about what is depth, how do we adjust the depth, but basically what I want to show is that this mode is the B mode or the 2D mode, which is like the black and white mode. And main thing is that how to get our image right or acquisition, which will be the other parameters, and we'll discuss about those a bit. Our image. Now what we want to see is that we have focused it better. Now we can adjust the sector width of this image, as Dr. Kamal had said that the temporal resolution can be adjusted by adjusting our sector width. So this is how we can have a reduced sector width and we can have a better temporal resolution. So as we, some parameters help to increase our frame rate. So when we reduce the sector width, we have a better frame rate of the image, and it helps in a better resolution, which is the lateral resolution. So better the reduce the sector width, we increase the frame rate of the image. Okay, so this is our 2D mode. Okay, now I want to go for now color mode. Okay, so next we talk about the color mode. Okay, so when we press the color mode, you can see there is a box which appears on the color mode. Now this box is mainly to look for the red and blue color, which we got to know that blue suggests that the flow is going away from the probe, and the red color suggests that the flow is coming towards the probe. So as you can see here, it's predominantly which is coming the red flow. That means the flow is towards the probe. Okay, now how do I adjust about this box? Okay, so now this box position, I select this button and I get to box size, and I can use my roller ball to adjust the box size. Okay, now if I have to go to the box position, I select again the box position, and when I kind of I can take my box wherever I desire to see my color. So I can adjust the scale of my color using the scale button. So I select this, and I can adjust the scale. So as you can see, my scale, if I want to take it to 20, 25, 30. So for the venous lesions, as we know, like if I have to see the pulmonary veins, I want to keep my scales closer to 30 to 35 so that I can look for my pulmonary veins. Okay. Now, once I've done my color view, so for the color, so we have learned about the B mode, 2D mode. Now in color, basically we want to see what is my box size, where is my box position, and what is my color scale. So as we can see in this is my like color, I'll just point it out. So this is my color scale. And when we know that we want to keep color scale closer to 15-20 for seeing my coronaries, we keep it closer to 30 to look for like pulmonary veins, SVC, IVC. When we take it to like normal echocardiography, where we want to see our valves and everything, we take it closer to 60. When we want to see our pulmonaries and aortas, we go to closer to 80 to 100. And when we talk about regurgitant lesions, which are at much higher velocities, we may have regurgitation lesions going up to more than 200 centimeters per second. So it all depends like what kind of lesion I'm seeing, and then accordingly my color scale needs to be adjusted to get a better optimized image for that. So sorry, going further, just one second. I want to look for any Doppler. So this is my the Doppler for I can use the pulse wave Doppler. So this is my pulse wave Doppler. Now before I go to the pulse wave Doppler, I want to select my cursor. Okay, so where I would like to keep my cursor. So this is my Doppler gate. So for the pulse wave Doppler, suppose I want to look for some TR jet. Okay, so I'll keep my Doppler gate above the tricuspid valve. So here I suppose I've kept it here, and I kind of do the pulse wave.
So this is the kind of image. Now suppose if I am able to see, but I'm looking for something, the flow which is towards the probe, which is the red, and the
So for basically pulse wave Doppler, first obviously where I'm placing the gate, that's important. What is the sample of my gate, that is important. Number three, it is important that what velocities I'm seeing. I might be seeing velocities which are like 100 to 200 centimeter per second. So I need to adjust the scale of my Dopplers, and also I need to adjust the baseline of my Dopplers. So these four things which are very important: the gate position, the gate size, the baseline of my Doppler velocity, and the velocity scales. So sometimes we are seeing like more of like images, the regurgitation lesion, or the blood flow is like more of blue flow. Then at times I have to adjust my scale up so that I can see my blue flow better, because that will be on the downside. And sometimes the velocity is higher, then I need to adjust my scale to maybe 100, 120, 140. Otherwise I will get something which is called as aliasing effect, that is my image will be cutting. So I need to adjust these four important parameters.
Below the baseline will be the blue, which is the away from the probe. But suppose I'm not able to see very well, then I can change my baseline, okay, so that I can visualize my flow better, which is like either above or below. Okay, so I've adjusted my baseline using this button. Okay, now suppose my lesion is a regurgitant lesion and my flows are coming like more than 200 centimeters per second. So if they are coming more than 200 per second, then the aliasing effect will start coming if I'm using only the pulse wave Doppler. So in that case, I'll stop pulse wave Doppler, and in the same area I will choose my continuous wave Doppler. Suppose this is my cursor, and instead of pulse wave, I'll choose my continuous wave Doppler. Okay, so continuous wave Doppler can get in like flows which are even like beyond 200 centimeters per second. Doppler. So, and I want to do pulse wave Doppler, and I want to choose the Doppler sample gate. So when I press PW, then you can see there is a sign which is coming sample volume, the sample gate volume. Okay. So how do I adjust the sample gate volume? Is that I select this sample gate volume size, and I can adjust it to like as high as like even 15 millimeters, or to as small as even 0.5 millimeters. Okay. So that's how I can adjust my sample volume gate as well. Okay. Which we have to talk about is the M mode. M mode means it is the motion mode, or it is the mode which is mainly used for measurements. So if we want to measure LA ratio, if we want to measure the ejection fraction, so that's the mode which we use. So if like suppose I'm doing this for this baby and I press my M mode. So M mode, what it will do is, you can see there is a M line. Okay, so this line, wherever I place, suppose I want to place it over here, and what it will show me is like here I can see that there is some diastole going on, there is some systole going on. I can see how my mitral valve is moving with the systole and diastole. Okay, so that's when I can do some measurements. If I freeze it here and I want to make some measurements, I'll take my caliper and I can make my measurements here, like, and I can make like, and automatically the machine will tell me, okay, what is the distance for, you know, what measurements which I want to select for. Okay, so this is my M mode. There are some additional these things in the machine itself. So as you can see in the machine, it is automatically, once I get into that area, like suppose I am in the Plex view, the machine automatically suggests some dimensions which it can take. Suppose I am in Plex view and I want to do M mode. Okay, so when I do M mode, so automatically the machine gives me option like I want to do aortic root diameter, or I want to look for left atrium diameter, and then accordingly it will show that there are some calculations which are options which are available, like LA ratio, or if I want to go for ejection fraction. So these options are available as presets in the machine itself, which can be utilized. Understood about the image.
So I think once now we have learned about number one, the data entry, we have understood about the probe which we want to select. Now we have understood about the central console, and we have understood about our knobs, which are the modes which we want to choose, and how the modes need slight modulation. Now comes that once we have selected our mode and we want to optimize our image. So suppose we are doing the B mode or the 2D mode, and now how do we justify that our image is of the right quality? So there are some 6 players which we talk about for the better acquisition of image, which is your gain, time gain compensation, depth, focus, zoom, and the sector width, which I'll be taking one on one. So number one, first we talk about the gain. So gain basically tells us that how bright or how dark, that is hyperechoic, which is bright, and hypoechoic the image appears. So just making the image too bright doesn't mean that the image is of the right quality. We need to have the right balance of both brightness and darkness. So increasing the gain amplifies the electrical signal produced by all the returning echoes, which in turn increases the brightness of the image. That is the basic principle of gain. So that it helps in the better identification of the object of the interest. However, as you can see, I have placed 3 examples in this image. Like my first image, if you can see, sorry. So I'll just take to the laser. Okay. The first image you can see is like a normal gain. Whereas if you can see in the B image, it is like more brighter. So the gain is too much. And when the gain is too much, at times we are not able to pick up the right disease or right pathology. So like if in case we are doing ultrasound cranium and our gain is too much, then in that case we can pick up undue hemorrhages which may not be actually truly there. So picking up too high gain can make the image too bright and amplify the background noise. Whereas if we make the gain too low, it can reduce our ability to differentiate between the structures. So as you can see, that C image is like a poor gain and B is too bright again. So we need to have an optimum balance of the both the dark and the light. Now, what is time gain compensation? So this is also one of the important parameter which we need to adjust. Most of the time we kind of, have a habit to keep the all, you can see this, this thing is the time gain compensation buttons. So basically it is something like gain only, but when we adjust the gain, sometimes our near object is like bright, but our deeper object is of dark. So we try to adjust these knobs so that we have the right balance of the gain, which is for both near and the far objects. So if you can see here, we can see the near field is like dark and the outer field is black. And so we try to balance that whole of the field looks optimized of the optimized gain. So that's how we adjust these knobs to adjust both our near field and far field gain element. Now, very, very important element, which is the depth. So if one parameter I have to choose to adjust my image, that first and foremost will be my depth. So what do we understand that depth? Depth means that the depth of the image should be so that the desired structure should fall at least in center of our image, or it should acquire at least 2/3 of the acquired image. So the objective, if we set too high depth, then we can, we can probably cut out on the, or we can have a cropped image. And if we get too low depth, then we might not have the image right in center. It will be too small. So it is important that we adjust our depth in such a manner that we have the right place where our image is being, sorry, is actually showing. So if you can see in this that one second. So if you can see, I kept my depth 15 and my frame rate was 46. When I reduced my depth, you can see my image is acquiring, has come in the center, and my frame rate has improved, which has led to better image resolution. So that's how the depth is one of the very important parameter to improve the resolution and improve the quality of our image. Now, next parameter which we want to see is the focus. So, what is focus? The image resolution can be improvised by selecting the area of interest. So, suppose my in cardiac, like if I see my area of interest, suppose is my interventricular septum or my valves. So, this is my focus, and I want to get my focus to my valve area, so that when I position all my beams towards that targeted area of interest, my lateral resolution becomes better. My image acquisition is much better visible. So if I see in this image, you can see that when my focus button was showing towards this, my valves were not very clear. They were not very discernible. Now, when I've got my focus button here, you can very well see how my valvular area is more clear, more, with a better lateral resolution. So, so getting the focus button to the area of target is very, very important. And in the previous slide, how I showed you that sector width again can make an important, but most important basic parameters still remain, that we need to choose our depth right, our gain right, our time gain compensation right, and our focus right. And sometimes when we choose the sector width, when we reduce the sector width, we are able to improve our frame rate and helps in a better resolution of the image. So if you can see, this is my width of the image, and once I my frame rate, I adjust my frame based on that. So if you can see, my frame rate is 51 hertz when my this is my sector width. The moment I reduce my sector width, and I'm able to get a better frame rate, which is almost closer to 117 hertz. So by just doing small minor variations, I'm able to get a better resolution of that area, and my image quality becomes better. Same goes for when I'm doing color Dopplers. So when we have the color Doppler, as I told you, in color Doppler, we need to adjust where my box is placed, what is the box size, and then we need to adjust the color scale. So when we talk about color box size, so again, we improve the frame rate when we have color block size, which is of a smaller and a focused image. So if I talk about width of the Doppler, if it is increased, then there are more scan lines. It is a slow frame rate. And once I increase it, so I'll show the next image. So if the wider the box, slower is the frame rate. Smaller the box, better is the frame rate. So you can see the frame rate became 30 when it was a smaller box size. So again, better image acquisition. And this we have already discussed, that when we have to do Dopplers, we need to interrogate with the optimized flow. So if our flows are higher, get your scales of the velocity up. And if the baseline is not right, again, we may not have the right Doppler image acquisition. So baseline should be at the right place. If we are taking more of the blue flow, which is on the downside, then we need to get our scale up to get the entire flow pattern. And accordingly, this is the same thing, which is the right baseline. So you can see the baseline incorrect is cutting the image. When we get the baseline right, we have a better image quality. And also we need to choose that we want to go for pulse wave Doppler, or if the velocities are higher, the pulse wave Doppler will not give us the right Doppler image, and we need to get the continuous wave Doppler. And for the M mode, again, it is important that where the cursor is placed. So as you can see, the cursor should be right in the center of where it should be straight, and it should be right in the center to get the right image. If we are like tangential, or we are not cutting it vertically, then we can get the wrong dimensions. So the most important thing is that you should align the M mode cursor in the right linear, like the vertical manner, to get the right calculations. So just last video to show how image optimization, we have few important parameters which I have told you in the presentation. So the first and foremost parameter is the gain button. So in my machine, the gain button is in the 2D mode rotation only. So if you can see on the screen, when I am reducing it, it is becoming dark. When I am increasing it, it is becoming bright. Okay. So when we have to adjust the brightness, this brightness adjustment in technical language is called gain. So by adjusting the gain, we can see the whiter structure more whiter and the darker structure more darker. So we have to adjust in such a way that we have something like both bright and dark. It should not be too bright and it should not be too dark. So that's about the gain button. Now, when we have to see how adequately I am able to see the desired organ in the view field or the vision, then the depth button comes into the role. So the depth gives us about how deep it can view. Now, if I keep the depth like this, then you can see I can see only 1/3 of my desired organ. But what I want is that at least it should come to the 2/3 of my the field, visual field. So I have to adjust my depth. So if I reduce my depth, I can get it to the almost 2/3. If I increase, it is almost going to the minuscule. Okay. So I have to adjust my depth so that at least 2/3 of the visual field is able to visualize that organ. Now, once I've adjusted the depth, I have another button which is called as focus button. So if you can see on the screen, this focus, this thing is rotating. So this focus means that how much the ultrasound beam is able to give focus towards the desired organ. So if I see here, so this center button is giving maximum ultrasound beam to the desired organ. If I want more focus, I will reduce the size of this focus, and like this, I can reduce the size and I can get the focus more on that particular area desired. So I can adjust it like this. Okay. So this is the understanding for the focus button. Now, if I go to, there's another button which is called a zoom button. Okay. So in zoom button, suppose I have this organ and I have, like, suppose there's a left ventricle and I have to make some measurements of this ventricle. But to get a better assessment of that left ventricle, I want to see where I'm seeing the inner wall, where I'm seeing the outer wall. So I can just zoom that desired organ so that I can have a better visualization of that particular area. Now, zoom and depth, they are different. Depth means that I am giving the deeper waves, the waves deeper inside, so that I can view the whole, I can assess the whole view as deep as possible. Whereas zoom means only that particular desired area I am just expanding to have a better viewing capacity of that area. So they both are different knobs. Now, when we learned about the gain button, we saw that when I am reducing the gain, it is becoming dark, and when I am increasing the gain, it is becoming all bright. But when I am increasing the gain, as you can see, this area has become too bright and this area is like still little on darker note. So there is another button which is called as time gain compensation. Time gain compensation is also known as sectoral gain. Sectoral gain means that I can individualize the gains of my different areas by adjusting the gains of these. Like suppose I have these 8 buttons, so I can adjust sector wise
how much the gain I want in that particular sector. So normally, like if I start with like all my gain buttons, temporal gain buttons in the center, and then based on the desired organ, how bright or how dark I need it, I can adjust this time gain compensation. Okay. So we've discussed about these buttons of gain, and we have discussed about that time gain concepts compensation. So machine also provides a button which is called as iScan. So iScan is nothing else but an auto gain. The machine itself decides that how much gain should be given to this visual field. So this button is for the iScan. Image optimization.
So I think for the success of good image, what we need is the correct transducer. We need adequate amount of gel. We need the right preset. We need the right view. And then the 6 players, which is the adequate gain, depth, focus, time gain compensation, the right frequency, and if required, the zoom for better suppose particular like organ we want to see, and particular maybe measurement we want to see, and we want to just get the better idea about the structures. So also not but the least, but the right baby with neonatal who's in comfort zone, who's swaddled and secured with minimal of distractions or like ECGs, pre-warm gel, and minimal pressing and handling is also very important. The courtesies of our doing the neonatal echo, and some help from our nurses, adequate cleaning, and we should also know the things of our machine well, that we should switch it on and switch it off properly. I think by this I finish my talk. Thank you so much.
Okay, thank you very much, ma'am. Thank you very much for the excellent session, ma'am. And I really appreciated the hands-on tips shared by you. It's definitely give more confidence to use the machine. And also, I would invite the questions. If anybody have any questions, please write your questions in a chat box so we can go by the questions answered. I think there are no questions.
Swastika, is there any question in the delegates link? Because it's basically faculty link, we may not be
No,
able to
ma'am.
see the
We
question.
have checked it. There is no questions received from the participating doctors.
Okay, so no questions from delegates and no questions from faculty.
Maybe I was either too good or too bad.
No, ma'am, it's a very excellent, it's a very good session. Now, ma'am, it's over to Dr. Viraj for
Yeah, it was really a wonderful session. And before concluding the sessions, I would like to announce that next Wednesday, we are going to have a expert talk. And every second Wednesday of the month, we are going to have expert talks. And from next Wednesday, we are going to start with the preterm series. So, next talk is about first golden hour management of preterm infants, and the details of the sessions will be announced very soon. And after this, I just would like to thank all the faculties, my chief guest, Dr. Nirmal sir, guest of honor, Dr. Pradeep Suryavanshi sir, for their presence and their encouraging words for the Pathshala. I would like to thank speaker Dr. Avneet Kaur for having a wonderful presentation that was so nicely videographed that we felt that we are attending offline live workshop. So thank you, Dr. Avneet, for a wonderful presentation. And thank you, Praful, for coordinating and taking this program further and supporting me throughout for conduction of this program. And thank you, President Sir. Thank you, Dr. Mohit. Thanks all the participants for joining and attending this Pathshala. And here I would like to conclude the sessions. Thank you once again.
So thank you so much to all the dignitaries present here. Currently, is really glad to have all these brilliant people together in the session today, and I hope you all had a seamless experience. So, with everyone's permission, I'm concluding the session in here for today and looking forward to host you again. Thank you so much.
Okay, thank you.
Thank you. Have a good day ahead.
Yeah,
Thank
have a
you.
good evening to everyone. Bye.